Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Fazlur Rahman. He's a hematology-oncology physician. His Kevin MD article is an excerpt from his book, Our Connected Lives. The excerpt is titled From Doctor to Patient, a Life-Changing Lesson in Empathy. Fazlur, welcome to the show.
Thank you. Thank you for having me, Kevin.
So, before we talk about your book and article, just briefly share your story and journey.
Well, I was born what is now Bangladesh, and I had all kinds of trouble like so many other people at the time. And then I was trained in Dhaka, and then after that I came to New York 55 years ago as a young man and trained in Long Island Jewish Hospital and Queens General Hospital. That's where I did my internship. We did internship those days, internship and junior residency. And after that, I came to Baylor College of Medicine in Houston. And that's where I did my senior residency and also did my fellowship. And after the fellowship, I had to decide, what to do with my life. But because of circumstances, I wanted to be in academics. I came to the West Texas. You could say that a choice or a quirk of fate, and it worked out well with the help of my wife, ARA. And so that's where. And then over the years, I practiced cancer medicine, hematology, oncology for 35 years. And in between, I wrote my views, what I saw as a physician and what I observed, on medical ethics, on bedside medicine, on IVF, on CPR, on and some of the biggest papers in the world, you could say Guardian Weekly, New York Times, Wall Street Journal, Christian Science Monitor, Newsweek, among others, and
Sure.
personal essays like Harvard Review. Those are to express my own feelings plus what I saw as a physician and what I learned from my patients, along with my own experience. So all those things I did in between my practice. And then I wrote two books. This is the second one. First one is The Temple Road, a doctor's journey. That's about my growing up. And the second one is the stories of my patients and what I learned from them and how they dealt with me and how I dealt with them,
Mm-hmm.
and all those things, experiences, I put it together, 5 patients in detail. Each patient makes a point, so that's what summarizes my life.
Sure. So your latest book is titled Our Connected Lives, and you shared an excerpt from that. It's titled From Doctor to Patient, a Life-Changing Lesson in Empathy. So for those who didn't get a chance to read your excerpt, just tell us what this particular story is about.
The story is about that, when you practice, you are an internist, so you'd understand, and you take
Yeah.
care of patients. That's one thing I like about your podcast, because a lot of, I have due respect that a lot of policymakers, they're not really patient oriented as such, more business oriented.
Yeah.
So you would understand this. So you see all those things that I learned from my patient, how I dealt with them, how I affected them. And so that's one. And then after practicing 35 years, I had a hiking accident and I fractured my right ankle badly, actually.
Okay.
And I required detailed surgery. So here I remember Susan Sontag's quote. I mean, I paraphrase it. That is, when you are born with two citizenships, the citizenship of the well and the citizenship of the sick. So all of a sudden, from the citizenship of the well to citizenship of the sick. I thought that I knew quite a bit about empathy since I have practiced all these years. I read about it, but until I became a patient, I probably did not understand the depth of it, how it is important to be empathetic, to understand patients' anguish and difficulties, inner struggle, and all that the best you can. So that was the basis for writing that article, and it is a chapter of my book called Empathy Matters in Medicine.
Mm-hmm.
So it's an extract from there.
So you mentioned that when you were a patient and you had to undergo a procedure to fix your ankle, you were surprised how important empathy was, even though you're a cancer physician yourself.
Right.
Tell me what exactly surprised you.
I think that remember, the science is the basis of medicine, but science alone cannot solve everything. Like I just told you, you can't feel people's anguish and their difficulties in a way. So they later he became very nice. But the point is that I became to him, it looked like I was a technical challenge.
Mm.
It's a difficult fracture and he can fix it, which he did. So is that enough? That's the point, that it's like a little bit of impersonal. that I'm just going to take care of the fracture. And what happens to the human being? The ankle is attached to an individual, as a, So that was the thing that's probably sort of instigated me to write this piece. That was the surprise that it's a technical channel, and he did took care of it. But beyond that, it seems like being interested in human being and his fracture are kind of a little bit different. You know what I'm trying to say? Go ahead.
So, what would you have liked to see more from the patient standpoint? In an ideal world, you would want an orthopedic surgeon to see your ankle fracture as more than an ankle fracture. What would you have liked to see from that doctor?
I think I would have liked the doctor touch me and at least touch my ankle and see me and listen to my concern a little bit in detail.
Hmm.
And then after surgery too, they look a little bit in detail. I know nobody has endless amount of time. I was a busy physician too, and it doesn't take a whole lot of time to listen. So I would have liked the doctor to take a little bit more time with me and listen to my concerns. That I know the empathy word is thrown around all the time now. I've been writing about it for a long time before it was so much in fashion,
Hmm.
but it is real. And that's why I tell when I was teaching medical humanities, I start with Chekhov's word number 6, which is you can read it, and it's one of the best short stories I've read about how a doctor who was insensitive basically to the patient all of a sudden ended up being a patient in the same ward.
Mm.
And so that's word number 6. And then he was kind of punished and tortured the same way like his patients were. And then while he was basically dying, he says, how could I ignore it for 20 years? And why didn't I know that? So that's really I know it's getting philosophical, but basically, yes, taking a little time and showing a little more interest as a human being besides the disease itself.
Why
That's
do you
it.
think doctors today are less empathetic than they were previously? You're a practicing physician. You said you've been doing this for decades now. Do you think that it's more difficult for doctors today to show that empathy to patients?
Yes, I'm retired now for quite a few years. So the point is this, though. We were, you were a lot younger than me, we were, bedside medicine mattered a lot to us.
Hmm.
And I think that technology has improved and improved the patient care and quality of life. All these things have improved. But at the same time, if you take survey, patients are dissatisfied. Why 70% or so patients, they say doctor don't do personal touch anymore. Why it happened? First, I think then partly our fault, doctor's fault, because we kind of gave in to everything that was thrown at us. That's one. And then the second, in my time, I'll give you my experience when the hospital administrators or clinic administrators, they worked with us to help us,
Hmm.
correct? And sometimes they did what you required them to do because for patient care. Now, and I see these younger doctors and I have friends and others, and I go to doctors too. It's like administrators run the show. In other words, you have to see this many patients. I'm
Yeah.
not saying all the places, many places. And you have to have this much production and you have to have this much, if you do, I'll do incentive. I know one of your guests, and I do respect, was talking the other day about, well, doctor who does save money and good care, then that doctor should be rewarded. I understand that, but it's not that simple
Hmm.
because the criteria that you set up for quality care, it can be manipulated. You just put certain criteria and looks like I did great. So one is that they become very, very bureaucratic, administration heavy, and it's a it doesn't matter for profit or non-profit hospital. Non-profit hospitals are just as cutthroat.
Yeah.
Okay, so you read there was an article in New York Times last year with it. There's a hospital in a big chain. The CEO is getting $1 or $2 million salary. At the same time, they're cutting off patients' appointment or treatment because they owe a little bit of money or whatever, little or big. So one is that the absolutely like a profit motive become a big issue, and it's hard to. It's not healthcare is not Walmart. It's hard to make you know too much. You have to make profit to survive and to grow, but you
Hmm.
cannot make too much profit. That's one profit motive. I would say excess profit motive, you know. So that's one. And the secondly is that it has become the policymakers, for example, like you are an internist taking my interview, you understand the patient's difficulties, your
Hmm.
difficulties, and all that. And I write in my book my own failures, difficulties, how I dealt with my own weaknesses and all that, and doubts. So you understand that. But the people who are making policies nowadays, most of them have no, they may have MD in their name, correct? But they may not have anything to do with the patient care. You know? So
Sure.
they are the ones making policies and throwing at us. And then computerization supposed to help, but I often wonder that if you does it help the patient as such? You're taking care of patients. Whole thing we are doing all this big enterprise, only one person, and that
Sure.
is to take care of patients and to prevent diseases. Or you're just adding more patients to the doctor.
Yeah.
Okay. And then as a society, again, this is getting philosophical, probably ask me, we have to decide we cannot have both ways. Either we accept impersonal medicine and not complain, or we just let them make as much profit as they want to do, because you're a shareholder, or you own the hospital, or you own the company and all that. I personally know that there's a big chain taking over all these urgent care centers, 60, 70 of them, and they have insurance company, they have pharmacy, they have what is called middleman pharmacy chain,
Sure.
they have hospitals. So they pretty much control everything. So because of the business matter, and I wrote probably 20 or 25 years ago, there is an article I wrote for New York Times called "Take the Money Out of Medicine."
Hmm.
Okay, because I'm not a pre-scientist or anything, because I was seeing that these things are coming.
Sure.
You know, you cannot take the money completely out of medicine. My, there is a hospital chain, one of the biggest hospital chains. I'll give example. Uh, they wrote there was an article in New York Times that big hospital chains can make it more efficient, this and that. There was an article written by Robert Kushner. That's at least 30 years ago, probably.
Yeah.
He was supposed to be an expert. And so I wrote a small reply in the New England Journal of Medicine. I said that whatever I don't remember that they want to make 20% profit on on the revenue. And if the say 10% is average and are good, 15% is very good, then you can only do two ways. Okay, either you cut the service or you do something else. And the something else I meant is that cheating. And what do you think happened? The company got heavily fined, and federal government Medicare forced them to break into pieces, three
Yeah.
companies. So these are the things. I think that the excess profit motive, again, I'm not against profit, but excess profit motive, I think that is causing a lot of these problems. And then pretty much run by the people, policymakers, they have no connection with the patients.
You wrote in your excerpt that the inclusion of humanities in medical education can sometimes nurture empathy. So, talk more about that. How can you believe that the humanities in medical education can foster compassionate care?
I think that, like I told you in the beginning, that science definitely necessary. You need CAT scan, MRI scan, PET scan, and all that. And now the AI is coming.
Hmm.
But all those things again for patient care. But science cannot make you feel the patient's anguish.
Yeah.
Science cannot make you feel the patient's struggle. And but if you read like stories I told you, read stories like Ward Number 6, or a poem like Raymond Carver's What the Doctor Said.
Hmm.
Believe me, it will open your eyes. And then those things make you look like what happens. You are that patient. You're a doctor, but you could be that patient too. So, and then sometimes you see things in humanities, arts, literature, even painting too, that you don't see in the physiology or pharmacology.
Hmm.
So those things open your eyes. I know that with all the demands we have now in medical school, learn science and everything. That's why it's more important that we need to do medical humanities, because I'm afraid when this AI or all these things take over, we'll forget that again we're taking care of human beings
Hmm.
and to get carried away with the technology. So I feel like that humanities will still keep the connection with the human part, humanity part to us. So that's why I strongly believe in humanities education. And one of the schools that I work in the advisory council, it is University of Texas San Antonio Medical School, and they are very good at it. Most medical schools are doing now, but I
Mm,
feel like it should be part of the curriculum.
sure, sure. So, with all the advent of technology and AI and things that could potentially take away from empathy, how can doctors maintain that going forward with all the pressures, the time pressures, the money, the bureaucracy? It's becoming more and more difficult for doctors to be empathetic. So, what are some specific ways that they can maintain their empathy going forward in this world?
That's a very good question, actually. And I'm not sure there is an easy answer. One, you cannot avoid the current bureaucracy, this and that. I think that first, to begin with, we have to ask our legislators and others that maybe you need to change the system of medicine.
Hmm.
Laws alone will not solve the problem. So that's to begin with. So the doctors have a little bit more time, a little bit more to take time with the patients. So that's one. That is the hospitals and companies and all that. They need to understand that. I know it sounds idealistic. And then the second is that even with all this, medicine is still, very good profession. And, that you can make a good living, work hard, but at the same time, you can help people. There are not too many things you can do day in and day out like that. And I think right kind of students, I don't know, it's hard to select. Students have to go to medicine because when you're a young student and go to medical school and you see all these things, and then hospitals are talking about profit, hospitals are talking about incentive, okay? Then your mindset kind of changes,
Hmm.
that, I have to make money too, like they're asking to make money, asking me to make money. I'm not against income, So we have to select right kind of medical student that they're going to it not because of prestige or money alone. I genuinely believe that medicine was a calling than a profession. I say in my book too, Our Connected Lives, caring for cancer patients in rural Texas. By the way, even though it says rural Texas, the cancer patients suffer the same way, uh, similar way, the same way. Only some more, some less, depending on their disease and what kind of support they have. So, two, one that administrators, hospital, they need to change their philosophy and policy some, and legislators also look into it. Too many laws will not alone solve the problem. We have to send our mindset
Hmm.
as a society. And the third is the we have to select the right kind of doctors, I mean medical students, the best we can. And then the fourth, in the training, that's very important. The teachers have as much part. A lot of mentors, I was influenced by the mentors. Like my mentor in Dhaka Medical College was Professor S.M. Bob, a brilliant clinician. It's a
Hmm.
British system, and that's how we operated. But anyway, and he said that the healing begins with your reassuring presence at your bedside and your empathy for the patient. In I try to remember that, but did I succeed all the time? No, I failed many times on my own,
Hmm.
But we have to remember that the one why we are there in medicine. Are we there just to make excess money, or we are there to also help people?
Sure.
And the teachers have to give that impression that too, because sometimes teachings and mentors can influence a student or a beginning doctor quite a bit. So those are the things, the changing policy as a whole, and hospital administrators and doctor companies, they need to look into it. So is the insurance company. And there is an article I wrote for Houston Chronicle called, anyway, I addressed this issue quite a few years ago when the
Sure.
ACA debate was coming on. And then the training the doctors the right way and including humanities into it.
Sure. We're talking to Fazlur Rahman. He's a hematology-oncology physician. He's the author of the book, Our Connected Lives. We're talking about an excerpt from that book titled From Doctor to Patient, a life-changing lesson in empathy. Fazlur will end with some take-home messages to the Kevin MD audience.
Oh, thank you very much. I think that's one thing I like about it. If you are a doctor, especially beginning doctor, medical student, and trainee, I just told you that remember, try to read this word number 6, Raymond Carver's poem, what the doctor said. It will give you some understanding about the patients. And remember, your all the technology, AI, whatever coming with only for one reason, to take care of patients. So if you're a doctor, especially beginning doctor, older doctors, we are set in our own ways. They need to understand that. And if you're a patient, and especially cancer patients, that if you go to the doctor, try to understand the doctor. Plus, write down three of your most important questions. Why, what's bothering you? Otherwise, you kind of go all directions, especially nowadays, doctors don't give time. And so write down what is bothering you most three questions. Then that can, if you have time, then you can branch out that.
Hmm.
And then I know you have diverse audience, I believe. And if you're a caregiver, that's another thing. We never uh, talked about caregivers, only patients. So if you're a caregiver of your loved one, make sure you take care of yourself. And if you don't stay healthy, you cannot help your loved one. Those, and then the last point, then that if you are a doctor, whatever kind of doctor you are, try to learn something about the end of life care. 85 plus years are the fastest growing population in the country. Okay. So we're going to have more and more end of life care. Everybody's going to have end of life, but we're going to need more and more end of life care. So these are my take home facts. If you're a doctor and if you're a patient, if you're a caregiver, some of those points are very important to have a career in medicine and to take care of patients.
Fazlur, thank you so much for sharing your insight and perspective. Thanks again for coming on the show.